Hey y'all, Dr. Amaka here, Tips Tuesday. Today we're talking about facelift and neck lift surgery. The question being, is it time for a facelift? Am I a candidate for a facelift, or are there other things I can do to get to where I want to be? Now, many of you know me for my drainless tummy tucks, mom restorations, but I truly love facial rejuvenation and really the impact, the powerful impact it can have on patients. So let's get into it, shall we? In general, I think about three things, right? I think about, where does a patient want to be? Where are they? Number two. And number three is, what are their goals? Those three things are really going to determine, is it what surgery is it time for? And there's not really an ideal age per se that's like it's time for this. It's really about those three things. Where are you? Where you want to be? What's going to help you feel I live my life to the fullest. I feel so comfortable and confident in my own skin. And what are my goals, right? So examples always help. This is a patient who came, as you can see, she has some fullness in her neck, some jowls, beautiful woman. And she was like, I just want this to be contoured and refined. I desire kind of more sculpting in the jawline, a more kind of sculpted chin, for example. So for her, the answer was a facelift and neck lift. She had a deep plane facelift and neck lift. That'll be another thing I do, talking about deep plane and what that actually means. But she had that done. This is actually just 3 weeks after, so you can see still really early. Things are still going to change with time in terms of her scarring, her healing, and things like that. But she did well, and you can see this result would really not be possible with anything else other than a neck lift and facelift. And again, it all was contingent upon what her goals are. What did she desire from that? That's her from the front. You can see the difference in terms of, she also talked about the heaviness in the folds, and these are nasolabial folds. These are marionette lines. And she wanted that to be a little bit more refined and pulled, right? So again, facelift, neck lift was just really the answer for her. For example, this is a lovely lady who came, and really her thing was, she was like, the jowls basically a term we use for fullness here, where there's some weakening of the mandibular ligament. So for her, she was like, I have some fullness, some jowling. I want that to be more contoured, more pulled. Again, for where she wanted to be in her goals, a facelift and neck lift was just the ideal option. So let me show you her after. So that's her after. There's really nothing else that would have given this result, which is what she was looking for. You can appreciate like just how sculpted and defined her neck is. When people come in and they tell me they're doing this in the mirror, or this, I'm like, we all know that is going to be your neck lift, facelift that's going to really pull and contour the jawline, refine the neck, right? Okay, another example again. So that's kind of what this patient was looking for too. And the only thing that was going to do what she wanted in terms of just refining that jawline, when you think about that, it's going to be the neck lift. And so I have this on here just to show you. One thing that also often comes up is people think they were going to look scary like the day after a facelift or whatever. This is 1 day post facelift neck lift. So I actually went to her hotel to check on her, change her dressings, and I took a picture. And this is actually just 1 day. So I want to show this to show y'all like it is not as scary as it seems. Like these surgeries can be very refined, very natural. Go out somewhere and nobody would know, right? So just to show you that early post-op result, just to kind of take away some of the fear that comes with the recovery period that comes with the facelift neck lift. All right, y'all, more to come. Catch y'all later. Happy Tips Tuesday.